In which position is the patient placed for rectal suppository insertion? Supine, prone, left lateral, right lateral. Correct answer is option C, left lateral. Which site is used for heparin subcutaneous injection? Deltoid, abdomen, thigh, gluteus. Correct answer is option B, abdomen. Most accurate method for measuring liquid intake. Estimate by eye, use measuring cup, count number of sips, weigh the container. Correct answer is option B, use measuring cup. Best time to collect sputum sample is before breakfast, after meals, before bed, anytime. Correct answer is option A, before breakfast. Which is a non-pharmacological method for pain relief? Morphine, ice pack, antibiotic, sedative. Correct answer is option B, ice pack. What is the common root for checking core pulse? Temporal, brachial, carotid, apical. Correct answer is option C, carotid. Bright red blood on stool surface suggests hemorrhoids, gastric ulcer, peptic bleeding, constipation. Correct answer is option A, hemorrhoids. Which is the best time to assess bowel sounds? During sleep, before meals, between meals, after meals. Correct answer is option D, after meals. Purpose of incentive spirometry is to increase urine output, promote wound healing, improve lung expansion, reduce pain. Correct answer is option C, improve lung expansion. What is the most accurate method of medication dosage for children? Weight based, age based, height based, BMI based. Correct answer is option A, weight based. What is the main cause of pressure ulcers? Low protein intake, poor hygiene, friction and pressure, bacterial infection. Correct answer is option C, friction and pressure. A stage 1 pressure ulcer affairs is black scar, red intact skin, blistered skin, none of these. Correct answer is option B, red intact skin. Which pulse site is used for infants under 1 year? Radial, carotid, femoral, apical. Correct answer is option D, apical. Best time to perform perineal care in catheterized patient. Every shift, once daily, only if soiled, after catheter removal. Correct answer is option A, every shift. Non-pharmacological pain relief includes all except massage, guided imagery, distraction, morphine. Correct answer is option D, morphine. The purpose of a urinary catheter is to prevent infection, promote walking, measure output accurately, reduce blood pressure. Correct answer is option C, measure output accurately. Which of the following requires mandatory reporting? A patient yelling at staff, suspected child abuse, a patient refusing medication, a medication not available. Correct answer is option B, suspected child abuse. The nurse suspects urinary retention. Which action is appropriate? Offer oral fluids, insert an IV line, palpate the bladder, give faint medication. Correct answer is option C, palpate the bladder. Which technique helps reposition a patient safely? Full with arms only, use friction to keep patient stable, use a draw sheet, drag across the bed. Correct answer is option C, use a draw sheet. Which electrolyte imbalance causes muscle weakness? Hypernatremia, hypokalemia, hypercalcemia, hypocholeremia. Correct answer is option B, hypokalemia. First step in inserting a urinary catheter is lubricate the catheter, drape the patient, explain the procedure, open catheter kit. Correct answer is option C, explain the procedure. Eye contact may be considered rude in which culture? Western European, East Asian, American, Australian. Correct answer is option B, East Asian. Which site is preferred for IM injections in adult? Deltoid, dorsogluteal, vastus lateralis, ventrogluteal. Correct answer is option D, ventrogluteal. A contaminated dressing is best discarded in regular trash, sink, biohazard bag, toilet. Correct answer is option C, biohazard bag. Which is a common complication of immobility after surgery? Improved appetite, decreased cardiac workload, constipation and pneumonia, dehydration and weight loss. Correct answer is option C, constipation and pneumonia. What is the primary goal of using standard precautions? Prevent the spread of infection, reduce medication errors, improve patient hydration, increase patient mobility. Correct answer is option A, prevent the spread of infection. Best action if a patient starts choking while eating. Call the doctor, encourage coughing, offer water, apply oxygen. Correct answer is option B, encourage coughing. What is the main purpose of range of motion exercises? Improve sleep, increase appetite, maintain joint mobility, improve oxygen level. Correct answer is option C, maintain joint mobility. In elderly patients, the nurse must monitor for increased appetite, sharp memory, rapid wound healing, decreased skin elasticity. Correct answer is option D, decreased skin elasticity. When cleaning a wound, the nurse should clean from dirty to clean, circular motion from outside in, from clean to dirty in random motions. Correct answer is option C, from clean to dirty. What does cyanosis indicate? Normal oxygen level, poor oxygenation, fever, hypoglycemia. Correct answer is option B, poor oxygenation. A patient with dyspnea should be placed in High Fowler's, Trendelenburg, supine position, SIMS. Correct answer is option A, High Fowler's. Which findings suggest orthostatic hypotension? Drop in BP when sitting, rise in BP after walking, drop in BP when standing, stable BP during movement. Correct answer is option C, drop in BP when standing. To promote defecation, increase intake of fruitin, sodium, fats, fiber. Correct answer is option D, fiber. The Z-track technique is used during IM injections to reduce pain, prevent medication leakage, increase absorption, shorten procedure. Correct answer is option B, prevent medication leakage. What is the first sign of local inflammation? Swelling, heat, redness, pain. Correct answer is option C, redness. What is the best way to assess pain in a non-verbal patient? Ask painfully, observe behavior, monitor vitals, guess based on diagnosis. Correct answer is option B, observe behavior. Which site is commonly used to measure pulse in an emergency? Carotid, apical, radial, brachial. Correct answer is option A, carotid. Which site is preferred for measuring core body temperature? Axillary, tympanic, oral, rectal. Correct answer is option D, rectal. Which nutrient helps maintain fluid balance? Vitamin C, sodium, calcium, iron. Correct answer is option B, sodium. Which lab value indicates infection? Low WBC, low platelets, high RBC, elevated WBC. Correct answer is option D, elevated WBC. Which intervention helps prevent constipation? Low fiber diet, increased bed rest, increased fluid intake, decreased mobility. Correct answer is option C, increased fluid intake. Which nutrient is essential for tissue repair? Fat, carbohydrates, protein, water. Correct answer is option C, protein. How is body temperature affected by infection? It increases, it stays constant, it decreases, it causes hypothermia. Correct answer is option A, it increases. Which IV fluid is isotonic? 0.45% NaCl, 5% dextrose in water, 3% NaCl, lactated ringers. Correct answer is option D, lactated ringers. Which of the following is a clear liquid diet item? Milk, orange juice with pulp, apple juice, yogurt. Correct answer is option C, apple juice. The most reliable indicator of a patient's pain is facial expression, behavior, nurse observation, patient self-report. Correct answer is option D, patient self-report. What is the best time for a back rub? Before meals, after walking, at bedtime, during medication administration. Correct answer is option C, at bedtime. Which practice breaks the chain of infection? Hand hygiene, reusing equipment, wearing dirty gloves, covering mouth with hand. Correct answer is option A, hand hygiene. Urine that is dark and concentrated may indicate overhydration, dehydration, normal output, infection. Correct answer is option B, dehydration. Thanks for watching. Subscribe to the channel for the latest informative MCQs.